we're going to be making a Wagner tray impression. This is basically it's a patented material that looks it's kind of like compound material. So I'm just going to take a look and see what we've got here. Come on, a little closer. So I got some decent ridges here. I'm going to try to get into the retromylohyoid area. Just checking out the flanges and what I've got. Okay, so the cup it comes in, we're just gonna, I set my water at 200. You just want to be careful not to go straight in the mouth with when it's been heated to 200 degrees. So I'll let it cool down a little bit before I go in. But I think it recommends 160, I think. But you know, I just like doing it efficiently. So I go with 200 degrees. And then let's see. All right, so we're starting to get some softness of the borders. Now sometimes the lowers are kind of fast because I don't mind there being some space in here as long as I get all the borders. Like I don't mind filling that in with impression material. Okay, all right, so here we go. One thing I'm gonna do is stretch the retromylohyoid area out. Okay, all right.
Thank you.
So warm this up again. I'm gonna go for my initial try in here. I'm gonna make this a little bit longer just to make sure I get that area. All right, let's see. I'm gonna try this in. Stick your tongue out. Way to the left, way to the right. Okay, and that's good, thank you. Okay, so I had one fold over. We'll fold that back out. And overall, we're starting to get some good borders. We're gonna thin this down. I may try to use the scissors. We may end up using a burr in this situation, but we're already pretty close. Very good. Okay, we're gonna take a break. All right, so I feel like on this one, we are gonna end up using the burr. I prefer, you'll see in some of these, I use scissors, but what I've got where it's thick here, I don't see, there's not a great angle to trim that. So, but what I wanna do here is just make sure I've got the lingual part here worked out. This is a spot where in the past I've gotten spaces, so I really like to make sure this is perfect. And then one of these folded over earlier, so I wanna make sure I get that in a good location. But once I get things pretty close, then I'll trim these borders down. Okay, and roll your tongue back. Okay, there we go. All right, good, we fell down in there. So that is seating well. Stick your tongue out. Stick it to the left, to the right, straight out. And let's see, and let your tongue go back in. All right, before I'm finished, I'm gonna take a mirror and look right at this spot to make sure it's good. So now, looks like, let's see, I'm gonna grab a mirror. Let your tongue relax. Okay. Okay, so I was wondering if there was a torr there. There's not, so there was just a wrinkle there. So I went and straightened that back out and seated it. Okay, so now I'm gonna come over to this cold bath and freeze it. It's not really freezing, just meaning hold it where it is. And I'm gonna, again, I try to use the scissors as much as I can to not use this burr, but it's, on this one, I think it's gonna be better to use the burr. Hopefully this is charged. Yeah, it looks like it. So this is a LURACO electric handpiece. Honestly, I don't remember this where I got this. Oh, actually, just the name of it, .com, is looks like where you can find it. But it's cool. It's got a little holster. Feel like a cowboy, big shooter. How's it looking? Looking good? Ooh, nice. All right, so we should be able to just make these adjustments. I'm just scooting things away because it slings these little blue fragments everywhere. Sky loves it, don't you, Sky? Especially love cleaning it off the shelf, right? Okay, so I'm gonna fire this thing up. It's really nice and powerful. I like it better than using the air-driven ones. So my goal with these borders, or one of my goals, is for the width of the border to be the width of the flange of the future denture. So when the 3D designer goes in, he doesn't have to guess. It can just be be correct. Does that make sense, Guy? I've always felt like part of my job was to make life for the designer as easy as possible, or give them clear direction. I always also felt like if whatever lab work I give, whether it's digital or analog, I want the lab to see the work and say, man, if he's giving me work like this, if he's giving me great records, I need to give him great prosthetics. It's hard to, well, it's not hard, I guess, but it's not right to demand of someone else when you're not delivering on your end, you know? Isn't that right, Sky?
Absolutely.
Sounds like I'm giving marriage advice. That's right. Pretty much any relationship. But in this situation, a lab or clinic slash, or a lab slash clinic relationship or doctor. Also, when these borders are thinner, they give better adaptation. They just more easily flex. You know, I was talking to a colleague that works at the dental school. I was telling him I think that using these in the school setting could be helpful because right now they make initial impressions and they send off for a custom tray. Then you got to have them back in, trim the custom tray. Whereas if you were to do this, train the young doctors, future doctors on this, you like that how I stuck that in there and just kick that out? Pro move there. Yeah, so the upcoming doctors, they can just save an appointment, and that's better for the patients and everybody. Be challenging to be more accurate than you're going to get with this. All right, so we're going to go back in the warm bath. I don't think I made too much of a mess this time. So I tried to keep it over the counter. Probably helped that it was a little wet. Slung it around a little bit, but it's all right. And what I'm going to do here is just change gloves because I've got that debris on them, and I don't want to get the debris all in the patient's mouth and beard. I like the black gloves. They're good for videoing. Isn't that a nice contrast?
Very nice.
Blue on black. There's a song, Blue on Black. Tears on a river. Whisper on a scream. Doesn't mean a thing. Won't take you back. Oh, blue on black. Probably have a copyright infringement for that. Demonetize my video. I think most of them are anyway because music's playing a lot of times. All right, you ready?
Yes.
All right, so we're going to go back to the mouth. Oh, good. I got you trained. You know, you can tell how bright your patients are by how many times it takes for you to do the same thing where you don't even have to ask them to open a certain way or move their jaw. And stick your tongue way out, way to the left, way to the right, straight out. All right, so here's where I was saying I was going to get the mirror and look here. Yeah, and that's looking pretty good there. I verified you can, in fact, fog a mirror, so that's good. Means he's breathing. In case you missed that joke, Scott, I don't know. All right, so we got good borders. I mean, what do we go in the mouth 3 or 4 times? Not bad. I'm going to thin it here, then we're going to paint it, and we're going to make an impression. All right, so I've cooled it back down. Quick draw over here. This thing's also quieter than air-driven. Maybe I'll just have one of these for each room, guys. Probably wouldn't be a bad idea. I thought about getting this. Yesterday I had the thought, man, what if I had an x-ray sensor for every room? It'd be an investment for sure, but it would be like a lot less radio talk about where's the sensor. All right, so I'm going to double check this spot. Just because it's got folded that same way. After this, we need to charge this up, Sky. We got to make sure we locate that. I got a few blue bits here. Hopefully that's all right. All right, I'm going to trim this in and let the impression material fill that in. Okay, so we're going to dry it. Let's see. I'm going to roll these borders just a little bit more. Okay. All right, so for the adhesive, hopefully I can get this open. Oh, yeah. Somebody must have cleaned it. I always like to have at least 2 brushes. Because, why, Sky?
This is faster.
That's right, because we want to go fast. And even then, I thought I was being conservative there, but I feel like I have enough to do about 4 of these with the amount I poured out. You know, how do we like to paint this on, Sky? Thin or thick?
Very thin.
That's right. Like nail polish, right? Who wants to do that too thick? It probably doesn't need to be too thin either. It's probably a bad example. Too thin, you got to do a bunch of coats, right?
Sure.
Got to be just right. So unlike that, this needs to be super thin because all you need is a very thin layer to make the impression material stick. All right, that looks nice. So not pulled up anywhere. Dry that. Now, let's see. Do we have a team member who could pop into room number 4 for about 1 minute? All right, so we're gonna have another team member join us because Sky can't hold the camera and no, we don't want a different perspective. We want to let Sky's perspective go all the way through. I want you to help me keep him dry, okay? Thank you. So, I'm gonna change this glove just because I got the blue chunks. Oh man, both y'all's name's Sky. It's very tricky. What are the chances I got 2 Skies? I think I might have not hired somebody before because their name was Amber. I don't know if that's true. Sorry, Amber, if you're out there and you didn't get hired. You just couldn't do it. No. Can you hold that? All right, so she's got that dry. Now, I use a quick setting Exafast light body here. You don't need a lot of body because this impression tray is very accurate. You do need to be fast because it has a short working time. And you don't want to have it start setting. Then you get an uneven cure. All right. Well, we weren't saying names, but since you're here, Sky. All right. Nice, cool. All right, roll your tongue back. All right, so with this, I don't try to overseed it. I just gently push down because that's going to give me a better representation of my borders without too much pressure on the tissue. All right, and stick your tongue out. All right, stick it way to the left, way to the right. Stick it straight out again, and way to the left, way to the right. Stick it out again. All right, perfect. You can have it back. So I'm going to put my fingers. I'm either going to, if I'm using my left hand, I'll use my 2 right fingers. My right hand, I do 1 finger across like this. Now this is pretty much not moving around anymore. Oh, unless he does that. And then so I'm going to hold it down until it sets, and then we'll see what we got. Or you can stop. My mind, I don't know. You ready? All right, so we got that set. We're going to take it out. Woo, good job. All right. Yep, we got some beautiful, beautiful borders there. See, I'm not worried about bleed through on this type of impression because I just made it in the mouth. If this was a custom tray made by a lab, you know, I'd worry about pressure places. But I'm just not worried about this at all. And it's been working out great with that philosophy. So just a beautiful impression, beautiful borders. I'm going to trim these up. Actually, could you hand me a 12 blade? I'm going to trim these. I'm going to see if I need to get any more roll on this part here. The only part that's not perfect to me. Thank you. Thank you. Thanks, Sky. Trim this. All right, hand me the Regisil, please. All right, so what I'm going to do here, really this would be fine. It'd create a little bit of finagling on the designer's part. I'm just going to give it a try here to see if I can make it just a little prettier. All right, let's see. Roll your tongue back. Stick your tongue out. There you go, that's good. Go left and right. Okay. Okay, you can have it back. So the Regisil is just a bite registration material that sets in 1 minute. So for spots like that, a lot of times I'll use that material. Sometimes I'll just add to a sharp border outside the mouth and kind of roll it over manually or digitally, you know, with my digits. Yeah. Yeah, so to me that looks better. Yeah, so we'll roll with that. So next step for this case, we're gonna get a wax rim and get everything just perfect, get our jaw relation, and then we'll make the denture. Got it? Perfect.